Reporting same condition more than once. The same diagnosis code should not be reported more than once during a single encounter. Duplicating codes is not allowed. B13. Laterality rules. ICD-10-CM uses laterality to indicate whether a condition affects the right side, left side, or is bilateral. For example, H20.011, right eye. H20.012, left eye. H20.013, bilateral. When unspecified, allowed. Use an unspecified laterality code only when the provider fails to document the side, and there is no way to infer laterality from the medical record. Otherwise, always code right, left, or bilateral. Example: if a patient has otitis media but the provider does not document which ear is affected, then the unspecified ear code must be used. Documentation by non-providers. Coders may use documentation from non-provider clinicians only for certain data elements, such as BMI, coma scale, NIH stroke scale, pressure ulcer depth or stage, social determinants of health, tobacco use. These do not require provider confirmation. Provider still needed for diagnosis. However, the diagnosis itself must always come from the physician or other qualified healthcare provider. Non-providers cannot establish a clinical diagnosis. Tobacco example. For example, if a nurse documents that the patient is a current smoker, the coder may assign Z72.0 for tobacco use. But the diagnosis of COPD must come directly from the provider. SDOH example. If a social worker or case manager documents that the patient is homeless, you may assign Z59.0 for homelessness. Provider documentation is not required for SDOH codes. Documentation completeness. When documentation is incomplete, unclear, or conflicting, the coder must query the provider for clarification. Coders must never interpret or assume missing information. Syndromes. For syndromes, ICD-10-CM instructs coders to follow the alphabetic index. Many syndromes require multiple codes to report all manifestations. Example. For example, Down syndrome is coded from category Q90, but additional codes may be required to identify associated conditions or complications. Use additional code requirement. When the tabular list instructs, use additional code, it means that a second code is mandatory, not optional. This may include coding the infectious organism, a toxic agent, a drug, the severity level, or an external cause. Example. For example, pneumonia due to streptococcus requires J15.3 for the pneumonia and B95.5 for the streptococcal organism. Both codes are required. Code first, overview. A code first note instructs coders to sequence the underlying disease before the manifestation. This rule appears often in diabetes, hypertension, CKD, and many complication codes. Examples. For diabetic neuropathy, we sequence E11.40 first, followed by G63 as the manifestation. This follows the etiology first requirement. Complex example. In hypertensive heart and chronic kidney disease, ICD-10-CM provides precise sequencing rules. You must always follow the tabular list hierarchy exactly as written. Complications of care. To assign a complication of care code, there must be documented evidence that the complication was caused by medical treatment or a procedure. The provider must explicitly state this relationship. Intraoperative complications. Intraoperative complications include events such as accidental perforations, hemorrhage due to surgical technique, anesthesia-related complications. Documentation must support causation. Post-procedural complications. Post-procedural complications may include postoperative anemia, post-procedural infection, malfunction of implanted devices. These require clear provider documentation. Documentation requirement. For a complication code to be assigned, documentation must clearly show Checkmark a cause and effect relationship. Checkmark that the condition is clinically significant. Checkmark and that the provider identifies it as a complication. Without this documentation, the complication code must not be used. How conventions plus guidelines work together. Here's a simple workflow when a clinician documents diabetes with neuropathy. Step 1. Apply the with rule which presumes linkage. Step 2. Follow any code first instructions and sequence the underlying disease first. Step 3. Use additional code instruction to add the manifestation code. This three-step approach is the backbone of many coding decisions. Real example number 1. Case. Severe anemia due to chronic kidney disease stage 4. Step 1. Code the underlying condition per code first N18.4 for CKD stage 4. Step 2. Add the anemia code D63.1. Step 3. Confirm the CKD stage and any tabular list notes before finalizing the claim. Real example number 2. Case. Hypertension with heart failure. ICD-10-CM often provides a combination code for hypertensive heart disease. Assign I11.0 for hypertensive heart disease with heart failure, and then add I50X to specify the type of heart failure if required by documentation. Real example number 3. Case. COPD with acute bronchitis. Use the combination code J44.0 for COPD with acute lower respiratory infection. If the clinician documents a specific organism for the bronchitis, add the organism code such as J20X. Real example number 4. Case. Fracture of distal radius, initial encounter. Apply the injury rules. Include the 7th character for encounter type, use the placeholder X if necessary, and assign laterality. An example code for an initial encounter might be S52.501A, but always verify laterality and tabular list notes. Real example number 5. Case. Stroke 2 years ago with residual dysphagia. This is a Sequela scenario. Code the current residual condition first, R13.1 for dysphagia, then add the Sequela code I69.391 for the previous stroke that caused the deficit. Real example number 6. Case. Threatened miscarriage. This has a specific code, O20.0. Do not separately code routine symptoms that are integral to the threatened abortion unless the provider documents other, unrelated symptoms. Real example number 7. Case. Type 1 diabetes, uncontrolled, with ketoacidosis. ICD-10-CM provides combination codes for these presentations. Depending on documentation, use E10.10 or E10.11 and confirm whether the record indicates coma or no coma. Select the most specific code. Common rule mistakes. Watch out for student errors that appear repeatedly. Coding symptoms when a definitive diagnosis exists. Ignoring excludes 1 notes. Missing required 7th characters. Failing to use placeholder X when needed. Incorrect code sequencing. Overlooking automatic with linkages, and not reading tabular list instructions. Tips for accuracy. To improve accuracy, always check the tabular list. Read every instructional note. Code to maximum specificity. Prefer other only when the provider is specific. Use unspecified only when documentation lacks detail. And master the high-yield rules for diabetes, hypertension, and COPD. How to practice properly. Practice consistently. Code at least 20 cases daily. Focus on high-impact areas, diabetes, hypertension, COPD, CKD, and do injury cases with 7th characters. Identify excludes 1 and excludes 2 notes until recognizing them becomes automatic. Mini exercise slide. Now a short exercise for you to complete. Assign the correct ICD-10-CM codes for the following. 1. Chronic kidney disease, stage 3. 2. Type 2 diabetes with CKD. 3. COPD with acute exacerbation. 4. Fall from ladder, initial encounter. 5. Stroke with right-sided weakness, Sequela. Pause the video, code these, and we'll review in class or the answer key. Key ICD-10 sections to memorize. Memorize these high-yield rules. A7, the with convention. A5, excludes 1 and excludes 2. A13, seventh character rules. B10, Sequela coding. B8, acute versus chronic sequencing. B7, multiple coding. B9, combination codes. These are frequent test and job scenarios. Student checklist. Before finalizing any code, run through this checklist. Is there an excludes 1? An excludes 2? Is a manifestation code required? Do you need a second code? Is etiology sequenced first? Are symptoms integral? Is a seventh character required? Is laterality documented? Coding workflow. Follow this workflow for every record. 1. Read the provider documentation. 2. Identify the main condition. 3. Check for linked conditions using with. 4. Apply sequencing rules. 5. Search the alphabetic index. 6. Verify the candidate code in the tabular list. 7. Assign the most specific code. 8. Add any required additional codes. Student errors to avoid. Avoid these common pitfalls. Coding only from the index. Using unspecified codes when details exist. Sequencing manifestations ahead of etiologies. Forgetting to add secondary codes. Missing clinical relationships, and ignoring excludes notes. Lesson 5 Summary. In this lesson we covered code structure, NEC and NOS, punctuation and conventions like with, and, excludes 1 and excludes 2, etiology and manifestation rules, placeholder X and seventh characters, acute versus chronic, combination codes, sequelae, laterality, symptoms versus diagnoses, complications of care, documentation requirements, and applied all of this to real coding examples. Key memory tips. To retain this material, memorize the with rule. Always read excludes 1 instructions carefully, check seventh character requirements, drill sequencing rules, and focus on diabetes, hypertension and COPD. These repeat across chapters. Lesson 5 Review Quiz. Quick self-check. 1. What does excludes 1 mean? 2. When must you use the placeholder X? 3. In Sequela coding, which code is sequenced first? 4. When should you assign symptom codes? 5. What does the word with imply in ICD-10-CM? Pause now and answer these to test your understanding. Assignment for Week 5. For your week-long assignment, complete 30 case studies, take the 50-question MCQ quiz, perform documentation analysis, finish the coding practice worksheets, and read the introductory chapter for ICD-10 Chapter 1. Real coding practice, homework, practice coding the following scenarios: diabetes with complications, pressure ulcer staging, injury cases requiring seventh characters, hypertensive heart and renal disease, Sequela cases, and COPD with acute conditions. These build your practical skills. Your coding skill after Lesson 5. After this lesson you should be able to code ICD-10 accurately, apply sequencing rules, read and apply excludes notes, assign correct seventh characters, handle both simple and complex diagnoses, and avoid common beginner mistakes. Very important reminder. Every chapter-specific lesson that follows, lessons 6 through 17, will require you to apply the rules learned here. Consider Lesson 5 your foundation for diabetes rules, hypertension, CKD, injuries, obstetrics, neoplasms, infectious diseases, and complication coding. Next lesson preview. In Lesson 6 we begin Chapter 1, certain infectious and parasitic diseases. We will cover HIV coding, sepsis and septic shock, opportunistic infections, viral and bacterial diseases, excludes notes, and many combination code scenarios. This chapter is clinically and exam important. Thank you for completing Lesson 5. This is the most important lesson in your coding journey. Keep practicing daily. Your consistency will lead to accuracy and confidence as a professional coder.